Good evening, and thank you for joining us for another session of the Cancer Care series. I'm Anisha Nair Thavan, your host for the day. And today we are discussing the recent advancements in care for blood cancer patients. Now, the COVID situation around the country and the world is an additional challenge for cancer patients. The lockdown during the first and the second wave of the COVID pandemic suddenly stopped the treatment of cancer patients, while their ongoing medicines make them more susceptible to COVID infection. Cancer has also emerged as a comorbidity due to the low immunity of patients, and it makes caring for cancer patients challenging as well. Now, blood cancer is an insidious cancer which affects the blood, which flows all around our body and accounts for about 8% of our body weight. Now, there are no screening tests available for blood cancer, and the symptoms are also not very specific. Blood cancers are also called hematological cancers, and they usually start from the bone marrow or the lymph glands and then spread to the rest of the body. The good news is that due to advancements in treatment of blood cancers, now we have a high cure rate. But of course, it depends on the type of cancer patient has, his age, the stage of the disease, and how aggressively the cancer has spread. Now, while the storm of the second wave of the COVID pandemic in India may have ebbed slightly, the risk from the Delta plus variant remains. So, how can patients keep themselves safe, especially cancer patients, when they're pursuing their treatment? These are some of the issues that we discuss on the show. Plus, talk about cancer, what it means, how it affects. This program is supported by Shilpa Medicare under its public awareness initiative. Please welcome our expert who will throw more light on blood cancer and its treatment. We are happy to welcome Dr. Amrita Ramaswami, a consultant Haemato Oncology and BMT, Artemis Hospital, Gurugram. Welcome to the show, Dr. Amrita.
Thank you, Miss Anisha, and thanks for having me here on the show.
Dr. Amrita completed her DM in clinical hematology from AIMS in the year 2016. She then worked as an associate consultant and later as a consultant in hematology in Medanta, the Medi City, Gurugram. Thank you so much for joining us. Currently, she holds the post of consultant hematology and stem cell transplantation at Artemis Hospital, Gurugram. So Dr. Amrita is going to talk about all aspects of blood cancer, but if you have any questions, this is a golden opportunity to type it in and ask Dr. Amrita herself. She'd be happy to answer your questions to the best of her ability. So do use this opportunity and send us your questions. Dr. Amrita, let's start with this discussion. Now, what are the different kinds of blood cancers? Because I believe there are 3 or 4, or now you would say even a different 100 kinds of blood cancers in the world today.
So, blood cancer is actually a layman's term, for a whole lot of diseases that come under hematology. But if you would ask the most scientific term for a blood cancer, I think it would be a leukemia. So, a leukemia is actually a cancer of the blood cells. And even in leukemias, we have, very different types of leukemia, some that need to be treated immediately and some that, can are not very aggressive, some that you can wait and watch. So it's actually an entire gamut of malignancies. But then blood cancers, they have, as you rightly said, there are a whole lot of blood cancers and ranging from not so aggressive to very aggressive forms that need to be treated immediately.
Okay, so then can you tell us, because leukemia is the blood cancer, the white blood cells. Then we have lymphoma, we have myeloma. So what are these? What kind of cancers are these?
So we know that blood is produced in the bone marrow, and our blood contains a whole lot of cells. We have red blood cells, we have white blood cells, and then we have platelets. And
Plasma.
Plasma. Plasma is not exactly the cellular part of blood. It's the liquid component of blood. The cellular part of blood is basically the RBCs, the red blood cells, the white blood cells, and the platelets. So white blood cells are actually the cells which give rise to, blood cancer. And in white cells also we have many different types. So broadly speaking, if you would ask me, blood cancer, we can broadly classify them into leukemias and then we can classify them into myeloma, we can classify them into lymphomas. But all of these cancers have their origin in the white blood cell, and these are the different types of blood cancers, broadly speaking.
So, where does it start? Because, say somebody has lung cancer, it is suspected that it started in the lung. It may spread elsewhere. If a lady has breast cancer, we believe that the tumor started in the breast. So, blood is all over us. So, where does it start? And you said white blood cells is where, the cancer affects the cells. But why blood cells? And where does it all start?
So normally cancer is a transformation of a normal cell to a cancerous cell. So every cancer cell has a normal counterpart. So blood cancer, the normal counterpart is the normal white blood cell. And we have a whole lot of other cells. And blood cancer usually happens in the bone marrow, because bone marrow is the place where normal blood production happens. And it is the place where cancerous blood cells are also formed. So it is the bone marrow that is the origin of most blood cancers. And as we know, blood circulates freely throughout the body. So blood passes through all the blood vessels, makes its way through all the organs, passes through lymph nodes. So theoretically speaking, blood has access to every single region of your body. So if cancer arises in the bone marrow, then most probably we would kind of call it a leukemia or maybe a myeloma. And if it sort of arises in the lymph nodes, we call it a lymphoma. But we need to understand that the origin for all these cells is a blood cell. And as blood circulates freely throughout the body, if it presents in the lymph nodes, we call it a lymphoma. If it originates in the bone marrow, we call it a leukemia or a myeloma.
All right. So, how is blood cancer different from the solid tumor cancers?
We get this question a whole lot of times, are being asked by patients. Like, let's say the first question that the first thing that I would like to clarify is, unlike other solid cancers, blood cancers, most blood cancers usually do not have a staging. There's no stage 1, there's no stage 2, stage 3, or stage 4 blood cancer, for the simple reason that blood is present all over your body, and there is no stage 4 and there's no stage 1. But then, having said this, lymphoma is a type of blood cancer, and lymphoma is a disease in which you do have stages. In a leukemia, you do not have stages. In a myeloma, you do not have stages. So the general thinking or the general perception is a stage 4 cancer is something that is really advanced and it cannot be cured. That possibly holds true for a solid cancer, for a solid malignancy, because a stage 4 prostate cancer or a stage 4 stomach cancer is incurable. We can give chemotherapy, but you cannot completely cure the person of the stomach cancer, or you cannot completely cure the person of prostate cancer. The cancer remains, but you do have treatments for stage 4 solid cancers. Whereas a stage 4 lymphoma can still be cured with chemotherapy. So that is kind of a major difference between blood cancers and solid cancers. People generally have the perception that stage 4 cancer is something that's really serious and it cannot be cured. I would like to say that a stage 4 lymphoma also has a very good chance of being completely cured of his disease, unlike somebody with a stage 4 stomach cancer.
Okay, so that's very heartening to know. We will come to the treatment of different type of blood cancers as well. But first up, I want to understand what are the symptoms, because for breast cancer, women can feel a lump in their breast. For lung cancer, if they are heavy smokers, they can go for an HRT. A low risk of HRT. So, and for cervix, you have the pap smear. So there are some screenings. But what are the symptoms of blood cancer? How does one figure out that something is amiss?
So as you rightly said, I think blood cancers, they have very non-specific symptoms. So somebody might have blood cancer and still not be very aware of it. The commonest symptoms of blood cancer could be weakness. Somebody can just feel weak. They go get a blood test done, they get a CBC done, and in which there are some parameters that are amiss, and then it is found that the patient has blood cancer. So simply said, weakness can also be a symptom of blood cancer. But then there are certain alarming symptoms. Weakness can be a symptom of a whole lot of things. So if I said this on this show, anybody who has weakness would start imagining that that they have blood cancer. What are the alarm symptoms, or what are the alarming symptoms that should tell you that there's probably something that's seriously wrong? I would say weight loss, fever, unexplained fever, night sweats, especially when you sweat a lot in the night, and then awareness of any swellings in your neck, in your armpits, where usually normal lymph nodes are present. You can also have bleeding symptoms, like some minimum gum bleeding. Some people have nose bleeds. In ladies, they can just have heavy periods. So all these are kind of alarm symptoms. Like, let's say we have a lady who had a normal period, and for the last 2 months, she's feeling weak and she's having heavy menstrual bleeding. That is something that needs to be taken notice of, and she needs to be investigated by a doctor. Bone pains is also another symptom, generalized body pains. But if you ask for specific symptoms, I would say probably, bleeding from the nose, bleeding from the gums, and, very, very heavy menstrual bleeding, and weight loss, and swellings in your neck and in your armpits. All these are kind of alarming symptoms where you should seek the advice of a physician. And if the physician so feels, the patient, he or she should be referred to a hematologist.
Right. So you said that these are the symptoms, serious ones that one should not gloss over. Then how is it diagnosed? Just a simple blood test, is that it?
So usually a simple blood test. I have had patients who just walk into your OPD. They come and tell you, I've had a pre-employment health checkup and my CBC has flagged up some parameters. And I have seen patients being diagnosed with blood cancer just because they underwent a pre-employment health checkup. On the other end of the spectrum, we do have patients who are seriously ill and they land up in the emergency, and it is found that they do have blood cancer. So for diagnosis, I would say a physician consultation with a proper examination. A physician should initially have the suspicion that he's probably dealing with a hematological malignancy, and then a simple CBC test, which will tell you what the hemoglobin is, what the platelet count is, what the white cell count is, could also help in diagnosing a blood cancer. Simple CBC sometimes is enough to say that somebody has blood cancer.
All right. Now, who is at risk of getting blood cancer? Because like smokers stand at risk of lung cancer, and particular genes, the presence of particular genes which is hereditary could make a few more women susceptible to particular kinds of breast cancer. Is there a subset of the population that is more at risk for blood cancer?
Unfortunately, there are no specific risk factors for leukemias or myelomas or lymphomas. Very few of these blood cancers have a particular reason that you can pinpoint on, saying that this is probably why this person developed blood cancer. I think the hardest or the strongest association would be if somebody has been treated in the past for a cancer. Let's say somebody had prostate cancer and he underwent treatment with chemotherapy for the prostate cancer. Few years down the line, let's say 5 years or 6 years down the line, there is a probability that he or she may develop blood cancer. So prior history of chemotherapy or radiotherapy or treatment for another malignancy, usually a solid malignancy, like let's say breast. Somebody was treated with chemotherapy for carcinoma breast. there is a possibility that this particular person may go on to develop a blood cancer in the future. So the prior history of treatment for cancer is a strong risk factor for developing a blood cancer. Apart from this, I think everything is, there's no hard evidence that if you do this, you'll probably end up with blood cancer.
But are there any genes which are responsible? Because nowadays a lot of gene testing is happening, and when a patient who's taken chemotherapy develops blood cancer, then do you say that the cancer is recurrent, or is it totally different?
No, somebody who has received chemotherapy for a solid cancer, for a different cancer, because chemotherapy drugs do impact the bone marrow. Chemotherapy is important in the treatment of cancer, but then everything comes with its own side effects. So somebody who has received chemotherapy has some changes in the bone marrow, because of which he or she can go on to develop a blood cancer in the future. And regarding your other question about genetic problems, gene defects which can predispose to cancer, yes, there are certain genetic syndromes which run in families which are inherited, which predispose a person to multiple cancers, not only blood cancer. Suppose we have a young 24-year-old with stomach cancer and blood cancer. There is a good chance that, he or she probably carries a gene which has predisposed them to develop both these cancers at a young age.
Mm-hmm. That's quite unfortunate. But, one thing is there, Dr. Amrita, that in childhood, once children have cancers, leukemia is the largest of all cancers. I mean, the largest percentage of cancers in childhood is actually leukemia. Could you explain why this happens?
There's no real reason why acute lymphoblastic leukemia, which is the most common blood cancer in children, in short, it is called ALL. It's more common in children, but the happy part of the story, or the happy
ending,
happy part of the news, or whatever you may say, is that it has a very, very high cure rate. Let's say we have an adult with ALL and we have a child with ALL. So if you treat both of them with chemotherapy, the chances of the child getting cured are upwards of 90 to 95%. Whereas if you treat the adult with the same disease, the chances of cure would be in the ranges of around 50 to 60%. Even though acute lymphoblastic leukemia is the most common blood cancer in children, I would like to emphasize that it has very high cure rates with conventional treatment, with chemotherapy, and most children have a very, very good chance of getting cured. Whereas it is not the case with adult acute lymphoblastic leukemia.
All right. Now, in the beginning of the show, you told us that there are many different types of blood cancers. So, are there any type of blood cancers that are more serious, more aggressive, more worrisome for patients? Because you said there's no staging in blood cancers, right? But particular kinds of blood cancers, are there some which are more serious than the others?
So the acute leukemias are the ones that are more serious. So in acute leukemias, we have two types. One is acute lymphoblastic leukemia and acute myeloid leukemia. Both are serious blood cancers, and they need to be immediately treated.
Immediately treated. So what is the treatment? Because, for solid tumor cancers, you'll have some, radiation or chemotherapy followed by surgery and then maintenance treatment. What is the treatment for blood cancer?
So unlike other cancers, blood cancer, as I earlier told you, it's there all over the body. So there is no role of surgery in blood cancer. Whereas if you have a stomach cancer, a very early stomach cancer, localized stomach cancer, surgery is what takes upper hand. We sometimes have patients with very early stomach cancer who do not undergo chemotherapy and radiotherapy. They go to the surgeon, the affected part of the stomach is removed, and all is well. Whereas in blood cancer, there is no role for surgery, and I would say a very limited role for radiation also. Because blood is all over the body, blood cancer is assumed to be all over the body, and treatment is only through injections and drugs, which we call chemotherapy. So
Okay.
this is the major difference in treatment between solid cancers and blood cancers.
What is the cure rate of this kind of treatment, which is just injectables and medicines?
So there is no blanket cure rate because each cancer is different and the risks of treatment in each person are different. So I cannot actually say, this is approximately what the cure rate is for this particular malignancy. It varies from person to person and from disease to disease. But as I've told you, childhood ALL has cure rates of greater than 90%, 90 to 95%. Acute myeloid leukemia in adults has around 50 to 60%. And acute lymphoblastic leukemia in adults also has around 50%.
Right. Dr. Amrita,
50% may not appear to be a great number, but that is still a good number. And I think a lot of people do get better, do get cured of their disease, provided they end up with the right doctor and they take the right treatment.
Right. Dr. Rita, a lot of advancements have been made in the treatment of cancer, where we are having, targeted treatments. We have immunotherapy. Could you elaborate on the newer ways to treat blood cancer, and what is the role of stem cells and bone marrow transplants?
So bone marrow transplant is a procedure that we do. It's not a surgical operation as perceived by some parts of the public. It's not a surgical procedure. It's a procedure that we do to replace the diseased bone marrow of somebody with blood cancer. It's a treatment that we offer not only for blood cancer. In case you have a diseased bone marrow which is not producing blood as it should. So the name of such a disease is called aplastic anemia. It's not a blood cancer, but then your marrow is not normal. So in simple terms, just like when somebody has a bad kidney, you give them a replacement. So when somebody has a bad bone marrow, which is either replaced by cancer or not functioning as well as it should, you replace the old marrow or the diseased marrow with a normal bone marrow.
All right. Dr. Amrita, we've got a question from a Facebook viewer. I wonder if you can take this up. So the Facebook viewer is asking, I want to know, in case of diabetic and ALL type B cell, if neuropathy develops, what could be the substitute for VCR?
So that's a very consultative kind of question. I'm not sure whether I should be taking this on this show. I think it would be better if I did not answer that question.
All right. It is quite specific and technical as well.
Somebody who's probably being treated for the disease is having this query, but then I think this is not the forum where I take, such personal questions. I would be happy to answer this question on a video consultation, and my credentials are out there, my details are out there. So in case this person does want to consult me, I'm happy to answer this question.
Right. So, Dr. Amrita, you spoke about bone marrow transplant, much like another organ transplant. What is the role of stem cell treatment? Does it work for blood cancer?
So, a bone marrow transplant and a stem cell transplant are literally one and the same. So, stem cells are the cells which actually give rise to your different blood elements. So, when somebody has a blood cancer, you give them a new source of stem cells. The stem cells can either be got from the blood, where they are called peripheral blood stem cells, or they can be removed from the bone marrow, where they are called a bone marrow stem cells. So in both cases, the transplant is one and the same. It's just that the source decides whether it's a bone marrow transplant or a stem cell transplant. I think both terms are kind of synonymous, and I think a stem cell transplant is a better term these days.
Right. Dr. Amrita, when it comes to organ transplant, it's not seen as a simple process because, getting a donor is not easy. The body accepting it also, you can't say, it always works. So are there risks attached to bone marrow transplant or stem cell treatment?
Definitely, there are risks attached to stem cell transplant. Every treatment, be it a simple paracetamol pill that you take, everything has side effects. So the basic dictum in medicine is you need to decide, the physician or the treating doctor needs to decide what are the benefits that probably derive from the treatment, what are the side effects of the treatment, and what are the side effects of the disease itself. So this is the first question that needs to be answered before somebody offers a stem cell transplant to a patient. If we feel that the risk of stem cell transplant is much higher than the risk of the disease, we would probably not be offering the procedure to that patient. But if we think that the benefits of a stem cell transplant outweigh the risks of that procedure, then we do offer a stem cell transplant to patients. A stem cell transplant is not the cure, is not the miracle cure for blood cancers. We need to choose patients carefully. We need to be very careful about who we offer a transplant and who we do not.
Right. Dr. Amrita, amongst the last questions, are blood cancer patients more susceptible during a pandemic? Because, the white blood cells are the ones that fight these infections and they're not functioning to the best of their ability. Cancer is coming. So how can they be treated during this time when, pandemic is on?
I would probably say that cancer patients in general, be it blood cancer or solid cancers, are a very vulnerable population in this COVID pandemic because let's say you have a sore throat and you want to go to hospital. You may choose not to go to hospital. You can get a video consultation in the COVID pandemic and get an antibiotic prescribed. You can just do this sitting at home. Whereas a cancer patient who is on chemotherapy or on radiotherapy has to visit the hospital, has to move out of the house, has to take an auto, has to probably take public transport to reach the hospital because his treatment cannot be interrupted safely during the course of the pandemic. So during the pandemic, we do have some cancers in which you can say, probably we switch from injectable medicines to oral medicines and advise cancer patients to stay at home. But sometimes we do not have that option of switching from injections to oral medicines and asking our cancer patients to stay at home. They do need to leave the house. They do need to come out and meet us in the hospital. So this places them at higher risk because they are moving out of the house because they don't have a choice. And the other reason why they are more vulnerable is because of all the chemotherapy that they receive, their immunity is compromised and they are probably more susceptible to infections in general, viral infections, bacterial infections. So these are the two reasons why this particular population, be it blood cancer or solid cancer, they are a vulnerable population during the COVID pandemic.
Right. As your last word, Dr. Amrita, what would you like to say to those people in the audience who may have blood cancer or know somebody who has blood cancer? What should they do if they are worried about stepping out at the time of a pandemic? And what is the role of vaccination here?
So I would say that you need to get vaccinated. We do offer the vaccine to most of our cancer patients. The thinking why some people may be hesitant to take the COVID vaccine, especially if they have cancer, is whether it's going to harm them or not. But then we need to understand that this population is very vulnerable and they need to be given priority for vaccination. And this is what various cancer committees all over the world emphasize, and they say that patients with cancer do need to be given priority vaccination for COVID and not the other way around.
All right. You would also advise patients to, continue with the treatments and not be scared to take treatment during this time?
Do not hesitate to get vaccinated, but please check with your treating physician, your oncologist, whether you can go ahead with vaccination.
And the treatment, continue the treatment as well, because some people, during the lockdown they're not able to travel. Some people who suspect they have some diseases are not going out to get it tested. What's your advice to these people?
So I would say COVID has taught all of us how to have a digital presence. A lot of hospitals have put up platforms where you can still have a video consultation, you can still get a home test done, and then you could still upload the reports and have a proper consultation with a doctor. And in case the doctor decides that you do need to visit the hospital, then I think wear a mask and step out of your house, and please do not hesitate to go to a hospital if so needed.
All right. Dr. Amrita, thank you so much for joining us and giving us such precious information about the different kinds of blood cancers, the impact on the body, the symptoms, and how it is treated. Thank you for joining us for this program and sharing the latest advances in cancer care.
Thank you for having me, and thank you, Ms. Anisha. Thank you.
Thank you, Dr. Amrita. I'm sure the audience has learned a lot. I've come up more informed after this discussion. This program was supported by Shilpa Medicare under its Public Awareness Initiative. Do follow us on Facebook to get all the updates on upcoming programs. We'll wrap up the show here. Till we meet again, stay safe, stay healthy, and take care. Goodbye.